name is Pamela Nyman, and I will be demonstrating the insertion of an NG tube today. So I would begin by verifying my physician's order for NG tube placement for low intermittent suction, and I will begin my procedure. I would perform hand hygiene upon entering the patient's room. Hello, Mr. Smith. My name is Pam. I'll be your nurse today, and can I just have you verify your name and date of birth for me? Very good. Okay. The physician has ordered for you to have an NG tube placed today for suction, and that will help to decompress your stomach and get rid of some of that nausea that you've been having. Does that sound good to you? All right. Have you ever had an NG tube before? You have not. Well, it's not very comfortable, but I'll explain everything as we go so you kind of know what to expect. So the first thing I'm going to do is just raise your head of bed all the way up. Okay, I'm going to put a towel in case you throw up. Don't throw up on your bed or your gown. And I'm also going to check your nose really quick, and we're just going to see which nose would be best to place the tube in. So right now I'm just going to shine a light and look. And there is no swelling, no deviation, no obstruction noted, no bleeding. And I'm going to occlude one side of your nose, and I want you to take a deep breath in your nose, all right, and take a breath through your nose. Very good. There seems to be good airway passage. So, do you mind which nair we pick? Okay. If you don't, we're going to go with the right because it's closest to me and it's easier. Okie dokie. So I'm going to measure the tubing from the nose to the tip of the ear and the ear to the xiphoid process. Excuse me as I pull the gown down and expose you. Alright, and I'm just going to put tape to mark my place. Alright, I'm going to go ahead and prepare some tape to place on your face. Okay, so I'm going to begin by lubricating the end of my tube. And what I'm going to have you do is I'm going to have you hold your head as far back as you can. I'm going to insert the tube through your nose, and when it gets down to your mouth, I'm going to shine my light to check and make sure it's not coiling, and then I will continue to advance it. At that point, I'm going to have you tilt your head to your chest and sip and swallow with the help of my lovely assistant, holding the glass of water with the straw right next to you, and we're going to advance it till we get to the marker. So I will let you know as it's time to do all that stuff. I just want you to be aware of what we're doing. So I'm going to have you tilt your head all the way back, and I'm going to insert, and I'm going to have you say, ah. Okay, tube is not coiling. So now I'm going to have you put your chin to chest and sip and swallow as I advance. So sip and swallow, sip and swallow, sip and swallow. And the tube won't go any further. So if it would, I would advance it to where my tape is. And I would tape it to the cheek to hold in place as I verify placement. Okay, and to verify placement, I would remove some content and check it on pH paper, and the gastric content is equivalent to the correct pH, so we are in the right place. And I would listen with my stethoscope over the stomach for a swishing sound to hear air to make sure that we are in the right place. And I did note a swishing sound, and also per facility protocol, if they would have me do a chest x-ray to verify placement, I would. And I'm going to connect the tubing to suction, which I just did. And to keep it in place, I'm going to tape and wrap it around the end of the tube attach, or before I attach it, I'm actually going to measure the length of exposed tubing from the nose to the end of the tube and place that measurement in the chart, which is 24.5 inches. And then I'm going to secure it to his gown, the rubber band. Like this. Without stabbing you, Mr. Smith. And once I have secured it, I would verify that the patient tolerated well. How are you doing, Mr. Smith or Jones? You doing well? You feel okay? Very good. And I would do patient teaching and instruct him not to get up without assistance so that he doesn't disconnect his tubing or dislodge it. I would instruct if he had any NPO orders to not have anything run out, I would verify that with him. And I would place the bed in low position, leave the head of bed between 30 and 45 degrees to prevent any aspiration, and I would put the call light within reach so that if he needed anything, he could obtain my assistance. And I would also note in the chart the consistency of what was withdrawn and the gastric pH content. And that would be that. Thank you, Mr. Smith or Jones, for your cooperation.